I'm delighted to introduce my two guests today, Dr. Tushar Patel and Kiran Kothari, are key figures in the Health Camp of New Jersey, HCNJ, an organization celebrating its remarkable 25 years of providing vital community healthcare services. Dr. Tushar Patel has served as the president of HCNJ since 2006 and has been involved in coordinating health camps since 1999, beginning with the organization's first health fair. Mr. Kiran Kothari, chairman of the Board of Trustees, is a pioneer member of the organization and has been dedicated to their services from the very beginning. In honor of their 25th anniversary, HCNJ has also announced a new initiative to establish a community health center in Central Jersey by 2026, furthering their commitment to community healthcare. Welcome to ITV Gold Studio, gentlemen. It's a pleasure, it's an honor to have you both here.
Thank you very much.
Thank you so much.
We appreciate it.
So my first question to you, Mr. Kothari.
Sure.
To kick things off, can you tell us about the history of the Health Camp of New Jersey, formerly known as the Indian Health Camp of New Jersey? How did it all start and what was the initial goal of the organization?
Yeah, so the history really started with a group of us got together and we were looking at elderly people from India moving here. Those, the baby boomers who came here in 60s and 70s, their parents were now coming here not just for a visit, but they are living here for a longer period of time. However, they did not have health insurance. That means they were not getting an annual physical that they really should at that age. So we thought that maybe we should do a health camp and provide that health screening for those who are uninsured or somewhere had some insurance but they were underinsured. So they would just not go to a doctor or a physician for a health checkup. So we started in 1998. Our first camp was at Durga Mandir. And we did not know how many patients will show up, how many volunteers will show up. But as they say, when you're trying to do noble work, angels show up. Well, that's what happened. We had over 200 patients show up that day.
Wow.
Yeah. And we had doctors came in, the nurses came in, the EKG technicians came in, and just in general, over 50 volunteers came in and helped us organize and administer the first camp. But what we really found out at the end of the day was that almost 20 to 30% of the individuals who came had some form of abnormality, something like high blood pressure or diabetes, that they had no clue, no symptoms. And so we realized that this is not only important, it's a necessary service for our seniors. So that's how the history got started. So our initial objective became a mission. And then we decided to do more camps. So the second year we did a camp at Durga Mandir, at the Balaji Mandir in Bridgewater, in addition to the Ved Mandir. And then let's fast forward to 2023. Over the last 25 years, we have seen over 12,500 patients.
Wonderful.
And provided totally free comprehensive health screening, which, if you go out for a health checkup, it costs almost $1,000. Multiply that by 12,500. We have provided to our community over $12 million worth of free service. That's our history. But we are going to do a lot more going forward, right?
So we are talking about 1998.
Correct.
So walk me through the scenario then. You were with a group of doctors, and what really motivated you to start this health camp? And the volunteers, how did, what was it like?
It came
back
down
then?
to helping the community. There are a lot of individuals in our community. They are really interested in giving back to the community. Most of us came here. Some of us came here with $8 in our pocket, but we have been blessed.
How much did you come with?
That's what my number was. So that's what I'm talking about, right? Since we are blessed that we have to give back, and not only just to projects in India, but these are people who are here, and they need to have that service provided to them, so that what we are really trying to do is to reduce the disparity that exist in healthcare, so that those who do not have insurance or are underinsured have the proper care given to them, and it empowers them to have a better quality of life.
Of course. Dr. Patel, for the past 25 years, HCNJ has been providing essential healthcare services. Could you share some of the accomplishments during this time, such as how many individuals have been served and the range of services offered to uninsured or underinsured individuals?
So, Nidhi, let me start by thanking ITV Gold, Parikh Worldwide Media, and our good friend, community friend, Dr. Sudhir Parikh, for his continuous support for last 25 years. I am so proud that he is being part of our organization as well by supporting the media part and all the support whenever we need for the coverage for our event. So I'm so thankful to Dr. Parikh for his commitment to our organization and our community. So past 25 years, we have been providing this comprehensive health screening, not only for the medical side, but for the dental and the mental health.
Oh.
And so far we have served, like Mr. Kothari said, more than 12,500 individuals and detected close to 4,000 chronic disease abnormalities. So our health screening, our fares are included the blood test, cardiogram, cardiology evaluation, physical exam, dental exam, mental health screening, pharmacy screening, pharmacy evaluation, medication management, influenza vaccination, female health care, and so many other ancillary services. So our health screening are about 6 to 8 hours every time when we do. And we get 100, 200, 300 patients every time. So far we have screened this many individuals and detected close to 4,000 individuals. And we don't stop there. So if somebody needs a follow-up for some high blood pressure or diabetes or some cardiac conditions or mental health conditions or eye conditions, we try to ensure that we intervene early. We provide the follow-up services with our local physicians, our community providers, and try to resolve those conditions as
would have
quickly
been
as
my
possible.
question,
Yes.
Like after the screening, what is the step two? You have discovered some abnormalities in them. Then where do they go if they are uninsured?
Yeah, so in last 25 years, we have detected some cancers, some breast cancer, cervical cancer, prostate cancer, some severely abnormal cardiac conditions, some abnormal thyroid, liver function test, kidney function test, some significantly abnormal medical conditions, and we intervened. We called the local physicians for them to see them at a very low cost, or in some cases we provided that cost. Also, we work with the New Jersey State Cancer Screening Prevention Program and many other organizations where we got their help to get their intervention earlier. Yeah.
You mentioned the healthcare is not the best in US. Why would you say that?
I would say that because those people who can afford getting the insurance are okay to get the services. There are about 9% of individuals in this country have no coverage. 7% in New Jersey alone, they don't have coverage. So 1 in 5 individuals who requires the screening services or the annual physical don't get it. So that means we're going to miss those diabetes, we're going to miss those hypertension, we're going to miss those cardiovascular conditions, mental health we don't even talk about in our community. So those things are very important. Cancer screening is very important. Vaccinations, every year you should be getting influenza vaccination, right now COVID vaccination. So all those vaccinations are very, very important. And the chronic care medications doesn't stop. So if you have a diabetes or hypertension or cardiovascular condition, you should be getting that medication on a regular basis. If you don't have insurance, you can afford because the medications are very, very expensive in this country. There is a huge disparity between those who can afford and those who can't afford.
If somebody needs, say, insulin like regularly and they cannot afford it, what do you do then?
So we are so fortunate. One of our own pharmacists, Ritesh Shah, through his charitable pharmacy 2 years ago, we are now able to provide those medications to those individuals who can afford at a no cost.
Really?
Yes,
Wow.
yes,
That's wonderful. That's such a noble thing to do.
yes.
Dr. Patel, it's clear that collaboration has been an integral part of HCNJ's work. Could you tell us about the organizations that have collaborated with you in the past and those currently involved with HCNJ?
So let me start with thanking Robert Wood Johnson, Somerset, RWJ, Barnabas Health is our partner for last 5 to 7 years now. Mentioned Ritesh Shah Charitable Pharmacy for last 2 years. For our mental health partner, Samin, South Asian Mental Health Initiative is our partner. Penn Medicine, Princeton Healthcare is our partner. And New Jersey State is our biggest partner, New Jersey State Health. They provide the eye screening through their Commission for the Blind and also through their cancer screening and detection program called NJ-SEED program. So all these organizations have been working with us for past 25 years. Some little less than 25, but most of them are working for almost 20 years. And we are collaborating with them to get the maximum benefit to our community. And we are very successful in doing that.
So you mentioned, let me start with dental screening. How do you do that?
So we have dentists come on board at the health fair. They bring all the equipments for dental checkup. They check for the oral cancer. They check any cavities or if anything they need, they do the initial dental screening right then at the spot.
Because, getting the dental work done is so expensive.
Yes.
And mostly your insurance doesn't even cover half of it.
Exactly.
So do they also contribute or, do charitable work?
So yeah, they do. Sometimes I refer the patients to them and they do at a very, very low cost or no cost at all. So we are so blessed. Our dentists in our communities are also part of our...
Especially, because when the parents come, they get like basic healthcare done, but they don't get like the dental done.
Yes, yes.
And, as you'll have it, they'll have some pain and then
Yes.
you wouldn't know what to do and they'll have to go back and cut down their trip and go
Absolutely. And one thing I want to add here is the healthcare is not only for the medical side that you take care of your diabetes or hypertension, but the oral healthcare is very important.
It is.
Because you get a lot of complications by poor hygiene or not getting the oral healthcare done, getting your diabetes or your cardiovascular conditions not in control if you don't control your oral health. So I think it's very important to get the oral health as well as the mental health. It's
When
very
you
important.
say mental health, like you have psychologists or psychiatrists
So we have a
coming
team of psychologists and psychiatrists and the social worker
at the screening
at the
time?
screening sites.
Oh my God,
Yes,
wow.
yes. Yes, we
And have you got like patients or have they been able to, like in a short time, they have been able to evaluate them and come to conclusions?
Yes, absolutely. We have a good team of psychiatrists and psychologists who provide that screening done. And we have identified or diagnosed so many mental health conditions and intervene to help those individuals. Yeah, that includes young individuals also.
So mental health, does it have to do with your external environment or does it have to do with the wellness of your brain as well?
Both. It's both. So I would say both because the depression and the schizophrenia or the mental health conditions are sometimes related to your genetics as well. But external conditions like peer pressure and drug or alcohol use can also stimulate those conditions.
Mr. Kothari, could you provide details about this special event, including what is planned for the celebration?
Well, we have a phenomenal 25-year history, and it's an all-volunteer team. So it's important that we commemorate this fantastic work that they have done. So that's one of our main things, that we want to honor them, we want to cherish the work they have done for the community and for those who are disadvantaged in our community. And of course, second thing is we want to also let people know that we are going to take the next step of opening a health center, because that will provide not only the services, we will continue to do the health camps, but once beyond health camp, where would they go? This is where they will have a place to go. So, and what we're gonna do, of course, is a gala. There'll be dinner. There'll be fantastic music. We have a Bollywood team from India, orchestra from India who will be performing. So it's gonna be a fun evening. You will meet a lot of wonderful, like-minded people. And please, can I mention our website name?
Absolutely.
Yeah, so it's www.ihcnj.org, www.ihcnj.org. And I'm going to ask Dr. Patel to give his phone number.
Yes, my number, if anybody wants to contribute towards this wonderful cause or buy tickets, it's 848-391-0499. Number again, 848-391-0499.
And the event is on Sunday, November 19th at the Balaji Temple Auditorium in Bridgewater, New Jersey. So please come and have fun and learn about what we do and what we have been doing. And maybe some of you would join our team. We have over 140 volunteers.
Wow. And they come from all backgrounds?
They from all backgrounds, yes. All backgrounds.
So Dr. Patel, to continue serving the community for another 25 years, innovation is often the key. Are there any futuristic technologies or healthcare trends you foresee integrating in HCNJ's services in the coming years?
So right after the COVID in 2020, 21, 22, we started doing the electronic registration for our health camps. Before we used to do paper applications. Now we do everything electronically. So everything is automatized now. Everything is done electronically through the registration online. The next thing we are doing now, all the lab reports come through electronically and we distribute to the patients electronically. So we send them an email with their lab reports. With this community health center coming up in next 2 years, we will have most likely electronic medical records for those individuals. So a lot of things now, instead of paper, we'll be doing electronically. So we can track the data, because the data is very, very important for the government grants. If we show the government or state government or federal government that we have data for our chronic disease, I think we'll get more grants, and I think that will help our community as well.
So being Indians, do they come with like some special chronic diseases versus other people?
So diabetes, hypertension, and cardiovascular disease, all three are very prominent in our individuals, South Asians, because of the eating habits, the lifestyle. They do, a lot of people, and a lot of IT individuals who sit on that chair for 8, 10, 12 hours. The second bad habit is they eat late at night, 9 o'clock, 10 o'clock, and go to bed at 11 o'clock. So I think those living habits won't help them to get the healthier lifestyle.
Tell me more about the health center that will be opened. Are there going to be doctors on call 24 hours? What kind of facilities are going to be there?
So our initial goal is to open up a clinic, community health center, Monday to Friday, few hours, 5 to 6 hours per day.
Okay.
And probably once we reach at certain numbers, we probably can expand that services. It's not going to be like urgent care that people can walk in and get the urgent care. It has to be an appointment-based clinic, like a community health clinic where you make the appointment and go see a physician. So we will hire a physician, hire a nurse practitioner, an administrative staff initially, and we'll start with a small scale and grow bigger.
Okay. And would you need your insurance to meet them, or is it like free of charge or donation?
So we'll have both ways. We'll have a community health center for those people has insurance and those who can't afford. So it's going to be a combination of both.
And are there going to be any beds there for any? No.
No beds. It's just going to be an outpatient kind of a
Okay.
clinic. Yes.
Okay. And those doctors, they can prescribe medicines.
Yes. Yes.
Okay.
We may have some contract with the pharmacist, with the X-ray companies and the MRI and CT scan. So I think all those things is going to be worked out within next 2 years.
Wonderful.
Yes.
So either of you can answer this one. Celebrating the 25th anniversary is a momentous occasion. Can you tell us about a touching or heartwarming story of an individual whose life was profoundly impacted by HCNJ's services?
So let me start with one example. Last year we had a camp at Balaji Mandir. One of the priests who did not have an insurance, he probably still doesn't, he came to our camp with no symptoms. We took the EKG, it was quite abnormal.
Wow.
Luckily, not luckily, but we always have a cardiologist at the camp. We rushed him to the cardiologist. Cardiologist looked at it and he said, take him to the hospital right now. We took him to, we sent him to the hospital, Robert Wood Johnson in Somerset, and they took care of him again at no cost. That's one example of how we save lives.
Yeah.
And I think I'll ask Dr. Patel
Yeah.
to give an example about a cancer patient.
And that priest had a bradycardia call. His heart rate was under 50. He needed a pacemaker right away. And he was reluctant to get the pacemaker done. We went back and forth. We had a counseling with him. Finally, he agreed. And now he's perfectly healthy. He had a pacemaker done at no cost, thanks to our physicians through Robert Wood Johnson. And examples like this, we had a breast cancer patient on a stage 4 we detected during the mammogram at our health camp. And many other examples of prostate cancer or cardiac conditions where we intervene early and save lives.
Wonderful.
Yes.
God bless you both.
Thank you. Thank you.
So, Dr. Patel, looking ahead, what are the long-term plans of HCNJ and how do you intend to sustain and expand these vital community healthcare services?
So uninsured individuals are less likely to get the preventive health care. And HCNJ goal is to provide the preventive health care, diagnose the chronic disease earlier, and provide early intervention to reduce complications and save lives. By opening this community health center will allow us to do that. Initially, we will do with private funding, donations, sponsorships, but our long-term goal is to get the funding from the state and the federal government. We are in the process of doing that. We have started the process. Hopefully 6 months, 1 year down the road, we'll get some funding and we'll sustain this community health center program for our own population, first time ever in New Jersey.
Amen. Of course. Would you like to add something
Yeah,
more?
let me just add a couple of things. I think once we have the first center in place, and we are looking at Middlesex County area, but then our community is pretty large in New Jersey, and we need to have. Okay, so there are other communities there are 21 federally qualified health centers in New Jersey, 0 for our community. This will be the very first one. So we will then expand to other counties where people do not, from North Jersey do not have to travel all the way to Central Jersey. People from Trenton do not have to come here. There will be one eventually, as you think about long term, that would be our goal, is to make sure that everybody has that ability to have the proper healthcare screening available at no cost.
You mentioned there are already federal funded health centers here. Then what would make your health center different from any other?
Yeah, they have, he will give the technical answers, but
Yes.
it will be pretty similar. But, it's not going to be just for Indian community. Once you open a center, it's available to all qualified individuals. But let me have...
So
Dr.
let
Patel
me
give
tell
the
you,
specific-
the South Asian, specifically the Indian population, we are the least community getting the benefits from the state, local, or the federal government as far as the benefit goes. And healthcare is probably the last thing people knows where and how to get the benefits. By opening up this community health center will allow us to at least reach out to those who can't afford getting the initial screening done on a regular basis. And I think that is the goal here. There are so many, like 21, 23 community health centers in New Jersey alone. Jewish community, African Americans, Hispanics, Latinos, they have their own and they know how to get the benefits. But we are the so-called affluent community, we don't have that reach of getting the benefits from the federal or the state government for the healthcare system. And I think that is the whole reason we are coming up with this community health center. And this has been a dream of many community leaders, community physicians for last 15 plus years. I was involved in an initial meeting 15 years ago. Nothing happened that time. And now we are ready and we are committed to provide this community health center for our own community in New Jersey.
Absolutely. So as Dr. Tushar Patel and Mr. Kiran Kothari celebrate their 25th anniversary and plan for the future, it's clear that HCNJ's mission to serve the community remains as strong as ever, promising even greater outreach and care in the years to come. Before we leave, please give out details of the program, day, date, venue for the gala celebrations to our audience once again, and thank you so much.
The event, the 25th anniversary gala, is on Sunday, November 19th at the Balaji Mandir Auditorium in Bridgewater, New Jersey. Starting at 5 p.m. onwards, we'll have dinner and then we have an orchestra from India who will entertain you, and we'll have fun evening. So come join us. Our website is ihcnj.org, www.ihcnj.org, and please buy their tickets or donate. And those, the physicians and other volunteers who just heard our story, this is going to be so unique, and it's a distinctive initiative and a very first for our community. Join us and help us so that we can do this for our community.
And you can reach out to me, 848-391-0499, if you want to get more information about our event or the future plans of Community Health Center. And also, I want to thank all our dedicated volunteers, committee members for your hard work, dedication, and community service for the past 25 years, and looking forward to your continued support.